Hi, good evening friends. This is Colonel Pradeep Pendyala, Professor of Anesthesiology at ASRAM Medical College, Eluru City, Andhra Pradesh, India. Friends, today I am going to talk briefly, very briefly about intra-aortic balloon pump. I'm sure you must have heard about it. Intra-aortic balloon pump, IABP. It is one of the earliest and most widely used types of mechanical circulatory support. This device acts by external counter pulsation and it uses systolic unloading and diastolic augmentation of aortic pressure to improve hemodynamic. Friends, this video is basically being made for my postgraduate students who might be benefited by this brief short video. So what are the type of questions which can be asked during Viva about IABP? What is the mechanism of intra-aortic balloon pump? If you see this, when the ventricle has finished contracting, the balloon starts inflating. Especially when the left ventricle has finished contracting, the balloon, intra-aortic balloon, starts inflating. This inflation helps increase blood flow to the heart and the rest of the body. As the left ventricle is about to pump out blood, the balloon deflates. That's the mechanism. This deflation creates extra space in the aorta, which allows the heart to pump out more blood. That is how it is beneficial. The IABP can worsen the situation if there is aortic regurgitation. So you have to be very careful. In an aortic regurgitation condition, is better avoided. How does IABP increase cardiac output? Very basic question. The physiological effects of IABP supports which can increase coronary perfusion. That's very essential. It should increase coronary perfusion pressure by increasing diastolic pressure and increasing the cardiac output, primarily by reduction of left ventricular afterload. So how does this IABP increase cardiac output? Very basic. The increase in cardiac output with the intra-aortic balloon pump is between 0.5 to 1 liter per minute, and that causes the impact. As I had mentioned, contraindication of IABP could be uncontrolled sepsis, uncontrolled bleeding, diathesis, or moderate to severe aortic regurgitation, which I just mentioned. Does IABP require anticoagulation? Yes. It's very much required because anticoagulation should be used whenever possible for all the IABP patients. What are the complications of IABP? Whenever you are using any therapy, you must know the complication. It can damage the blood flow to the limb, causing ischemia, rupture of the balloon. That's catastrophic. You have to be very careful of not rupturing the balloon. It can cause injury to the artery. Incorrect position of the balloon can cause injury to the kidneys. That's very dangerous. And low platelet count because of its insertion can cause further excessive bleeding. It can cause infection and it can also cause stroke. So what are the benefits? It allows blood to flow more easily into the coronary arteries and also helps the heart pump more blood with each contraction. How long an IABP can be used? That's a wonderful question. The catheter, normally the IABP can be used from few days to even up to a month. What are the contraindication? I did mention aortic regurgitation, dissection, aneurysm. But the potential benefits of IABP must be weighed against its possible complication, like bleeding, systemic thromboembolism, limb ischemia. That you have to outweigh the potential benefits. You have to assess. What is the most common site of IABP? The intra-aortic balloon pump normally, which decreases the myocardial oxygen which increases the myocardial oxygen perfusion and indirectly increases cardiac output by reducing the afterload, consists of cylindrical polyurethane balloon and sits in the aorta approximately 2 centimeters from the left subclavian artery. This is always asked, which is the exact location of most common site of the IABP. That is, it is 2 centimeters from the left subclavian artery. That's the answer. What happens if the IABP rupture? That's, as I mentioned, can cause huge problem. It can cause substantial damage to the iliofemoral arteries, and which can require vascular repair by end arterectomy. That's a huge problem. As I mentioned, the primary goal of IABP treatment is to improve the ventricular performance of a failing heart by facilitating an increase in myocardial oxygen supply and a decrease in myocardial oxygen demand. And can it be used in cardiogenic shock? Yes, while cardiogenic shock following acute myocardial infarction was the actual main indication for the IABP. However, the recent trials is causing slightly decline in its routine use. Is the heparin used in IABP? Yes, of course. The heparin requirement for IABP is around 16 units per kg per hour. So, what is the goal? The goal of PTT, partial thromboplastin, time goal is 60 to 80 seconds when you are using IABP. And how to prevent the complication? Proper IABP weaning and the use of Fogarty catheter at the time of balloon removal can be used to increase or decrease the complication. Which is the gas used, either carbon dioxide or helium? Several aspects of carbon dioxide or a helium as a driving gas in the intra-aortic balloon pump counterpulsation were reviewed and investigation, and carbon dioxide seems to be significantly safer than other gases but not benign. Helium produces faster, that is the reason helium is usually used. Helium produces a faster balloon response, but the physiological significance has not been exactly understood or defined. Does it increase cardiac output? Yes, definitely. While balloon counterpulsation augments aortic pressure, this increase may not improve cardiac output or decrease pulmonary capillary wedge pressure. That you should know. Thanks for patient listening. Have a wonderful day. I'm Colonel Pradeep Pindyala signing off for tonight. Today is 19th of March 2023. Have a day. Have a wonderful. Good night.